other multi-streaming that I can do. Um, Welcome. So I was just trying to announce some of my activities there, especially the workshop I was doing on Saturdays, which is we call it workshop on journey to the holistic wellness. See, that's what I'm fond of, right? I was asking people to be proactive about their wellness, and also it should be holistic in the sense it's not just some symptoms in the body and the mind, but an integrated approach to body, mind, our inner feelings, emotional, and also societal and spiritual. So several aspects of it. If we think like that, it's much easier to embark on that, right? If you don't think and then you put the health and wellness on the back burner, which a lot of people do, not because they are negligent or anything, but they just feel that they have more important things to do at the office, or they have more stuff to do than just staying and getting some tests done and then getting bogged up. That's how they view it, and then we see patients who are already advanced in chronic diseases, or already about to have a significant cardiac event, or for stroke or a heart attack, or maybe cancer disease. All those things happen. People go on smoking for years and years, and then when they are struck with cancer, they are very surprised. So it's kind of that kind of non-attention to it. What I found was it's good to go and get treatment done for illness. That's no problem. But can you be so intelligent and be preventive if you are really have facilities and insurance and all that? You can protect your health much better by being proactive. Go and get blood test and everything done ahead of time, and go and really fix things when they are really small, and nip it in the bud. That's what we call about it, right? Or if you are engaged in lifestyles, go and get them evaluated, and then also you can really um, uh, take action, right? Asking people to really look at some of the things that may be running in your family, or maybe you have a sign of it and you read something about that, that kind of thing. Just being smart and active, and be actively taking care of your wellness. Towards that, there is a journey that you have to do from where you are. First, you have to have assessment, and then determine in order of importance what are the problems, and then list them, and then go and fix them, right? You may have fixation for all the problems you found, or you may not, but at least your approach will be different. You won't be caught surprised by that. Okay, I think this is a very commonsensical approach. Many people really do that. I really appreciate those people who are doing that, but I'm talking about the people who are not, and really encouraging them to take a look at that and save a lot of money, time, energy, and also a lot of suffering down the line. Okay, even some of the nurses who are working in the hospital. The actual cases were there was one nurse that she has worked for 35 years as a nurse, and she knows a lot about the health, obviously, but she didn't take care of her, seeing for the blood in the stool, because she didn't want to look in the toilet bowl. And then when she came to me, when we did the colonoscopy and all that, we found that she has carcinoma of the colon, gut, right, large gut. And then we had to send her to the oncologist and put her in a long course of chemotherapy and all that. And she regretted that if she had seen blood in the stool much before than when she manifested, it would have been much easier for her, So she kind of, got the treatment and then was better after a while, but she really lost a lot of weight, a lot of energy, and all that too. So it's not just the cancer, it's the COPD, it's a heart disease, it's the cholesterol, it's the blood sugar, it's arthritis, it is so many things are related to our lifestyles, food, lack of exercise, lack of sleep, and also really stressing out with all the information and all that, right? So when we attend to proactive wellness means not only you pay attention to your past illness, your family's past illness, and also what is going on around the community, and then really looking at how you are subject to self with energy, with weight gain, with weight loss, or so many symptoms, chronic cough, or any number of things are there, right? People just because they are allowed to work and then able to work, they push these things aside. What I am saying is invest some time in yourself, go and have the preventative and complete maintenance check, and be on top of all the numbers that are related to you. And many people um, do come, do get things done, and they follow up and all. That's very good. Okay, but some people they never do. They never do, and then they'll have the problems with that too. So right after um, selling my clinic, I kind of embarked on this wellness journey, not only for myself, for my family, and for the friends and colleagues, but also the patients in general, right? And now that I'm online and really meeting people around the world, it's the same story. But some of the people don't have healthcare insurance and facility, and then they are really needing this kind of, uh, preventative attitude. I think so. So to that line, I wanted to start a journey for everybody to be proactively well, and I thought I would do the workshops where they can come and participate in the evaluation of their own wellness where they are, and from that way they have to go, either it is a treatment or really curbing the risk factors that are causing the problems for them right away, or really maintaining whatever health and wellness state they have achieved. So once you assess, you find out whether they are completely well and don't have to be touched, and then come back later, or they have some things brewing, and then discuss the risk factors that are brewing, like somebody's smoking, and we see the lung function is deteriorating with the X-ray, with the PFTs, with the peak flow, all the simple things that we do in the clinic that can tell you how your lungs are, how your heart is, and all that. Then we can tell you stop smoking, and then try to do these things to retain your lung function back. And lots of times people cannot stop smoking because it's a powerful psychological, physiological addiction, right? So knowing that where your lung is in terms of with your smoking, uh, a lot of people are surprised that they have damaged the lungs that much with the smoking that they were doing. Um, but then some people let it go because they don't want to find out anything, and then they let it go like that. And then they, when they really want to attend to it, it's too much. It's too big a deal, right? So I always on this bandwagon of preventing things and then being proactively well. And I really think I will be serving many people if I can find things very early and then treat them. Especially something like a cancer, you want to be the earliest diagnosis as possible, right? So suppose you have history of breast cancer in the family, and then you have seen a lot of people going through that, then you better get screening done. That's I think many women do. But that's only a small example. That's a very successful campaign for us, breast cancer, even treatment and all that too. But if you go to other cancers, colon cancer, lung cancer, I think they are not caught very early in most cases. Most cases, we caught at a stage where we have to give chemotherapy, radiation, and all that. Things are improving in terms of diagnostic ability, in terms of treating people with the cancer and all that. But still, there are a lot of risk factors, environmental, genetic, or food, and so many things. Carcinogens that we are ingesting or we are not aware that we are ingesting, right? Those kind of things. If you're not that subtle, simple things is what kind of food are you eating? Many people eat only fast foods and then surprised to find out they have such a high cholesterol, very angry. So that's also there. So be careful about the food you eat and the amount of exercise you get the body. And so uh, the sleeping patterns, a lot of people don't have the sleep at all, because this modern time clocks and all are pretty, uh, pretty, demanding. And that's just poor people. They're just thinking like, I'm working, I'm being doing my duty and all that. But then, you get to invest in your health also. That's why I have been doing, and I'm telling my friends and everybody like that too. So this movement towards holistic health is something I will do till I die anyway. So I will help as many people as possible to save their health, wellness, not suffer. That's the first thing, and also save their time, energy, and money. If I can do even few people, I'm happy. So some people are really listening to me and applying those uh, lifestyle changes. I call them TLC, therapeutic lifestyle changes. Okay, how many of you do have some things like that already in place and working, and you are not going to stray away from them? Come and tell me if you have any already going on. It could be a simple diet you changed, or it could be increase your exercise ability and capacity, or it could be that you are actively trying to be um, sleeping well, or you are able to understand how mind works and how to use it properly. Okay, there's a guest coming up. Let's see who it is. Rufia. Hi, Rufi. I've seen him one time before. Hi.
How are you, sir?
I'm good, Rufi. How are you?
I'm just fine. Thank you very
Okay.
much for asking.
Yeah.
Every day, new day, and learning new lessons.
Yeah, sure. So, what do you think? How is your wellness program?
Wellness progress, sir. I mean, I'm still doing great. I mean, I
Yeah,
have spoke with a lot of coaches at Noom Vibes
yeah,
before,
yeah,
and I believe you heard me. Saw you at some of the sessions too.
yeah,
And currently, I'm learning to the grief like if something bad happened to you, how you need to let that thing go. I
yeah,
mean, how your mental health is so important because letting go is the only option to keep yourself healthy and in
yeah.
your own circle so you can enjoy your happiness.
Definitely,
I,
definitely. Yeah,
I, I also need some advice from you.
mm,
I mean, I go to the gym regularly,
yeah,
okay? And I still have some, when you cheered up something. I mean, whenever I woke up, I have sometimes like I take 7 hours sleep, and sometimes it goes around 10 hours.
mm,
Okay, maybe because of my work, because I work around maybe 15 to 16 hours a day.
wow,
Okay, and I have to stare. I mean, I have to work on the two different laptops. I have to talk to maybe more than 200 and 300 people a day.
mm,
And I also, I mean, sometime it just went out of hands. I mean, the past just hit in my head like, like a hammer.
ah,
And it suddenly, I mean, it, moved my focus. mm, from the things like I'm currently doing.
Okay.
Okay, and this is why I shifted my whole house,
Mm.
because I mean I moved into a new house back in 2023. I mean I was
Mm.
about to get married, but the marriage was called off around 15 days before marriage. So I mean
Wow.
people told me, to shift the house because you don't have anything good in that house, you are going to get a bad memory. So I said no, I'm going to survive. But I survived. I lived
Mm.
there for a whole year, and I was
Mm.
really happy.
Yeah.
I hit the gym again. I bought some stuff for my mom, and I was taking good care of my parents. But then suddenly the things went out of hands because maybe I have a high blood pressure,
Mm.
because sometimes the things that triggers me really hard. And currently I'm also learning how to control my trigger ends. I
Mm.
mean, I don't have to, I mean, overreact to certain situation.
Mm.
I mean, I'm still trying to be calm in every situation, whether it goes against my will.
Yeah.
Because sometimes, I mean, I'm a type of a person, Dr. Rao. I mean,
Mm.
I act dumb to see the real face of the people.
Ah, okay.
And, and that's
Mm.
the reason I mean,
Mm.
I can't live with a lot of friends anymore.
Ah.
And I mean, it's just the life. So, what's your advice? I mean, because whenever I go to sleep, I mean, if sometime because maybe it's about the stress of the work, because I'm in a sales team right now. I'm a sales manager, and I have to manage. I mean, maintain the sales volume and generate the business for the company, so I
Okay.
can, I mean, maintain the revenue on a stable state. And
Okay. How is your
sometimes,
weight, Rufi? Are you overweight or normal weight or underweight? What is your weight?
no, sir. I mean, sometime I still face weight issue. I gained around 86 kg.
Ah, okay.
And I mean, I was doing great at that time, but at
Mm.
some point, I mean, I have to eat a lot. When you hit the gym daily,
Yeah.
about you work out around 1 hour to 1.5 hour,
Yeah.
and you need to eat, I mean, more healthy carbs and take more protein so you can build up muscle.
Yeah.
You know,
I was wondering
sometimes.
whether you have sleep apnea or not, So,
Yes, I mean it helps me a lot, because since I have moved my house, I
mm.
don't have to take the earplugs in,
Mm.
so I mean the noises weren't going to disturb me.
Mm.
I mean currently, I mean it's doing great, but just like I said to you, I mean every day is a new day to learn some new things about the
Yeah.
new lessons of the world, so you can survive the coming future.
Yeah.
And
No, that's good,
maybe.
Rafi. You have trying to fix things. That's good. You're not hiding them or running away from them. So this kind of assessment, either by your primary care doctor or you, knowing a lot of stuff, people can know about it. First, establish simple things like are you eating the right foods? Are you taking enough exercise? Are you sleeping okay? How is your mind working? All these things, I think Rufi is trying to tell me that he's trying to, you know, not to cling things, and also he's sleeping overly sometimes, and his weight maybe gained a little bit and then losing it and trying to get back. And this is exactly what we want you to focus and then figure out what is going on. It could be a visit to your doctor, or it could be some work with the coaches, health coaches, that they can direct you, and then you will be on the journey to the wellness. Once you made enough time to go and find out what's going on, look at your BMI, how it is. Is there any complaint that you are snoring a lot and you're sleeping? That also you want to look at it. If you have the sleep apnea, you have obstructive sleep apnea, because a lot of obese people can have that. I would really establish that with you. I'll first see your weight, I'll see your shape. Do you have a short neck? Do you snore? All these things come out, okay? And if you are sleeping and getting up and then you're very tired, you may be having the obstructive sleep apnea, then the oxygen won't go. I'm not assuming that you have it, but I'm saying you should establish these things. with the weight and with number of hours sleeping. That's for something we easily assess in the clinic. These days in the clinic itself, we can do the sleep test. So we can put on the equipment on you. You go home, and as you sleep, this will record what's going on. Whether there is any apnea, that means no movement of breath at all at the time. So all those, according to how many times you have those apneas, we can tell you how severe, and then give you just a guide, just like a CPAP that you can put it on. But I'm not assuming that you have a sleep apnea problem. I think you should get it checked out. I'm glad you are aware of what's going on, Rafi. That was the first step to take action. So if you give me the details, or you come to, you send me a DM, I can talk to you, and then we can come to see what we need to do next. I'll be happy to engage with you and then talk to you. Or you can come to uh, my several rooms I do at that time also you can talk to me. Okay. And I have a Facebook group. I'm going to set it up so that people like they want further to talk to me one on one, they can come there too. So let me know whatever I can help, I will do. But I need more data to really help you which way you should go. Okay. Thanks for coming up, Rufi. And this kind of enthusiasm about their own wellness really motivates me. This kind of thing I really enjoy because, I feel like we're not here just telling the theories and bookish stuff, but more like really helping people's quality of life. That would be my reward, right? So anybody else has any other comments or want to come and ask me any questions? You are more than welcome to come up and I'll engage with you. Lots of times, these lifestyle changes, people think, um, well, we will do it slowly. No, you got to really establish a routine, really have to have a discipline for a while, and then withstand all the temptations around us. So living in a modern society with fast food attracting you, with all the comforts of travel or using the cars and all that, even for small distances, make us sedentary, and also this prolonged sitting that is happening because of the computers and all that. That's also happening. And this sleep is a big problem, ubiquitous. A lot of people don't sleep properly, or they are using sleep uppers and downers. That's a problem. And also, the work schedules have become so much, right? Some people work in the night, some people work all day, and then they work late into the night with entertainment or late night, whatever. And so modern life has really caused a lot of problems for proper sleep. It used to be you are up and the sun is up, and then you work. And then when sun is down, you go and retire and sleep. It was that simple. And you got to figure out somehow you come back to that simplicity of enjoy and do everything when you are up. And then after sunset, don't go to the TVs, don't go to places of entertainment and all that, and stay up to 2 or 3 o'clock. And especially the kids, they are doing that now. The high school kids, the college kids, they are they're up very late, 2 o'clock, 3 o'clock, and then they go to bed, and then they get up in the morning. They're all drowsy, they don't have energy, and that kind of pattern of sleep is not good at all. Sleep is supposed to restore your body, restore your mind. But if you don't give a chance for that, how can it do that? Okay. So I would say, maybe you call me old fashioned, whatever, go to bed early and get up early. I still do that, so you can do that too. But according to age also, your sleep requirements goes down too. But whatever sleep you have, see the quality of it. What is the testament for that? When you get up in the morning, you're completely energized, both in your body and the mind. Then you had a sleep that worked for you to detoxify you, to really recover your body and mind to the normal state, which is very important. If you can do that, you can be more focused and clear in the morning, and you can really help yourself stay away from the chronic diseases that is there. Okay. Uh, so let me know, Rufi. You can DM me anything you want to tell me, and then you want some answers. We can sit down together, and then we'll talk about it. Okay. Don't worry. I will give you all the time that you need. Okay. So I am here to give back to the society. So I enjoy helping people to maintain their wellness in a proactive way. That's our reward. Okay, so if you need anybody else wants to come up, and I'll be here happy to talk to you. Part of the uh, part of the assessment that we do on the workshop is like a, important thing too. That assessment is there. We just hi Elizabeth.
Good afternoon, Dr. Rao.
How are you? I am good. How are you?
I'm blissful.
That's good. That's good.
Doing very well. Thank
Yeah.
you for asking.
Yeah.
I feel embarrassed because I've been mispronouncing your name for so long.
Yeah. Yeah.
And last night I heard you saying, "No, my name is Rao, not Rao."
Yeah, Kate was asking me that. She said I thought I was mispronouncing because other people are calling this. I said, it doesn't matter. They're just addressing me. That's why I don't mind. But actually, actually, it is.
I apologize. It was
That's
not
okay.
intentional.
That's okay. It's a Rao is a very common name, Elizabeth. It's like a John. Rao is a very, very common name. So,
Oh,
yeah, my whole name is like a long one, Hanumanta Rao. So I didn't want
oh
to.
yeah, that would be hard to pronounce.
Yeah, yeah. That's why I put it raw, and it is going well with a lot of people. Um,
Very good. Well, I don't have any questions. I
yeah,
just love listening to you talk about your workshops
yeah,
and responding to the questions that people have.
yeah. You see,
That is so awesome.
I want to develop this workshop so that it will be a tool for people to use it in a constructive manner. It's not just about learning a few things, but it's about putting themselves on the journey. If they're already on the journey, protect it and maybe communicate with other people. But many people that I see, 90% of them are either are not on the journey or on the journey but not able to get right help and all that. You see, uh,
Mhm.
lots of times doctors and other people don't have the time to sit down like this and then discuss diet, discuss inner mental attitudes, feelings, and all that. Because they are
Right,
limited time to see so many patients in so much of time and just to treat them for their sickness. So
right,
I want to encourage that in the medical practice where we are working on the root of those illnesses, not just fixing them for their symptoms and sending them back. In the long
right.
run, we pay a lot more money, Elizabeth. Don't you think so? Are not saving any money. We are not really helping all this costly equipment we buy, the technology and all that. And also, people are suffering. They go home and then they suffer in so many ways, right? The money is gone, time is gone, energy is gone. So some of them really end up in nursing homes and can't do anything. So I just want to,
Absolutely.
yeah, turn it around a
And
little bit.
that's what I love about your workshop, that
Yeah,
you are encouraging people to keep on moving and
yeah,
being flexible.
yeah,
And it's in our best interest to
yeah.
keep on moving our body and being
Mhm.
flexible. If we can do that every day, that's a win. And,
Yeah,
and that will prevent a lot of other illnesses in the
yeah.
future.
I sat down and wrote down whatever came to my mind, Elizabeth, about what are the things that people may ask that we can help. You know, of course, the stress and burnout they come out, and then I went on going about all the layers of the body and what people can ask me and all that. And that I'm going to make it available with people who are going to attend so that they can look at them, and also if they find something that is applicable to them or to their family or to their friends, they can ask. Then those were the points we're going to talk about rather than lectures on several things. The workshop is I'm going to come and find out what is going on with me and then ask questions and participate discussion, and maybe I will take something take home and I can implement it. That's the point.
Yeah, that's beautiful.
Yeah,
Very, very, very interesting.
yeah,
Very good.
yeah. Because
Well,
people may come and say, "Oh, I can't sleep," but then they may have sleep apnea. They don't know. So we have to see the person. We have to examine all those things are there. But these days, people are studying themselves and getting educated about so many conditions, which I always encourage, even from
right.
1980s, 80s.
Right. Well, yeah, we need to take care of those issues,
Yes.
and the more we move, the more we lose weight, the more
Yeah.
we take care of our health. Those
Mm.
those things will improve. Like remember, I told you I was feeling dizzy when
Yeah.
bending down. So
Blood
I went and
also.
see my
Yeah.
I went to see my doctor yesterday, as a matter of fact, because it was getting worse. It was
Yeah.
just it's getting, and today is not any much better.
Mm.
But he said to
Come up, Elizabeth. I want to hear about this.
so I told him what I was doing and what I was feeling, and he
Mm.
said, happening is that the medication that you're taking, you don't need it anymore because you've been losing so much weight.
Very
Your
good.
blood pressure
Yeah.
is affected. So he told me to stop it. And today is the first day that I have not been taking the medication. He
Very
said
good.
it's going to 4 days for the medication to pass through your system. And
Okay.
if you don't get it within a week, then call me back and let me know.
Hey, Elizabeth, I wrote a book on obesity. I'll let you see that book and then get it if you want. But in that, I was addressing a lot of things that are not covered in our modern medical practice. We don't know really how to train people about the taste, about the body image, about how to use pranayama to lose weight.
Exactly.
Yeah.
So no, I am hoping that this condition that I was experiencing fades away as in
Yeah.
the next 2 3 days.
Mm.
And I'm excited because I feel better in my body. I can move better. I can bend better. My
Yeah.
body feels more flexible.
Very good.
But
Very good.
but the dropping on the blood pressure is what it was affecting me.
Yeah, that's not good at all because medication associated that could really give you hypertension. That's why I was worried about your blood coming out and bending down. There are so many things that go into our mind, but generally that should not be happening. So the medications can
Right.
cause that too. Yeah, there is more obesity medication also. They have become such a controversial thing because of the side effects. And
Mhm.
also the price of it, now they are black market thing. People
Oh
are.
my goodness.
Yeah.
Yeah, they're very very expensive.
Yeah, and not only that, because they're so expensive, they are going for the black market, low priced but very heavily contaminated medications.
Exactly.
uh,
Exactly.
that is causing harm to the patients. That's why I wrote
Yeah.
that book, because you can take medications if you need, your doctor recommends, but I won't give it that quickly in my practice. And also I promote these lifestyle changes much more. And then if it is in spite of that they are having the problem, I would continue the medication. Otherwise I try to take it out as soon as possible.
Hmm.
you know
So that's what I did. Today is the first day that I'm not taking the medication. So I'm
Very
gonna
good.
see how I feel tomorrow.
Hopefully, yeah.
And
Yeah.
and I can move better. But I've been struggling. When I get up, that's when I feel the pressure dropping.
Yeah. Because you have this vasomotor response and postural hypotension. Suddenly,
Yeah.
because there's something else with you, Elizabeth, because you had weight and you lost it, that also has a bearing on your hemodynamics. So you are
Mm.
more vulnerable to these posture changes than other people were because you lost half of yourself, right?
Mm-hmm. Yeah. Yeah.
Yeah,
Yes.
yeah, that has its toll. Anything done, I would say it is can rather quickly or rapidly, and to adjust to that also takes time. And in addition, these medications which cause the vasodilation, that's what's happening. Your blood is pooling to your lower extremes very quickly, and that's why you feel the dizziness.
Mm, wow.
Yeah.
Yeah, it's not a good. It's not a good feeling. Let me tell
No,
you.
no. Actually, hypoglycemia, hypotension, like a low blood pressure, hypotension, they are not good for your brain. And those the dizziness are kind of a warning, and you want to fix that, as soon as possible.
Exactly.
Yeah,
So that's what I'm working on, Dr. Rio. Thank you
yeah,
very much for listening and
yeah.
for advising me and
Sure,
for
sure.
being here. I appreciate you.
Yeah, I am here for you guys, Elizabeth. So it's a pleasure.
Thank you, Dr. Rao.
Yeah,
I appreciate you.
yeah, sure.
Have a good evening.
Yeah, you too, Elizabeth. Elizabeth
Bye
is
bye.
herself is a health coach, and she has been advising a lot of people in so many good things. And the good habit is she absorbs and goes and implements it. That's a very
Yes, of course. That's what
yeah,
we need to do. Learn
yeah,
and use it to
yeah,
your benefit.
yeah. I
Yes.
get a lot of encouragement when I see people like you, Elizabeth.
Thank you so
Yeah,
much. I
because
appreciate.
yeah,
I
thank you.
appreciate.
Basically, if they are doing and they are getting the benefit, that's what any reasonable doctor will be happy about it, right? So that's what she is doing, and I'm glad she got it checked out. So this is kind of thing. When we have the workshop, we want it to be safe, but at the same time, a deep analysis of where we are, not what we want, what we wish, and all that can be there, but uh, where we are. So you can have realistic view of your body, or your, kind of build up desire, like I want to appear like a model, but I don't have it, so I'm not going to eat. Then the eating disorders come because of the psychological state and all. They're pretty bad. There are a lot of teenagers still going through because we promote body image quite a bit, right? So the young girls who are really skin and bones, but still they think they are fat. It's a psychological thing, right? Is it old? Is it not there? No, it is very much there. It's more also because they are promoting these kind of things through the internet. So the kids are very vulnerable for that, and they are told that you have to appear beautiful, you have to appear thin, you have to be like models, and you have to make up. Even makeup early, very early, they're introduced to the girls. So basically, they're encouraging the body image. But your worth comes from your inner strengths, or inner morals, or inner values, right? And also your own self-worth and all that. But just because you have a new cosmetic, and I mean, ordinary, that's okay, but it's an obsession about buying so much cosmetics to appear good for one evening. I think that's kind of breeding this lack of self-respect, and then people are really paying for it in terms of psychologically down and psychologically committing suicides and all that. So many things are happening to the young teenage girls. There was a study I often quote that was done on the smartphone use of girls who were using from 2014 to 2018. They took a survey, and they saw how many suicides happen in that time, because of these people are influenced by the internet and social media. The suicide rate during that period, 2014 to 2018, went up by 189% in American teens. So that disturbed me. And then that is true, though, because you are creating a completely different persona than what you really are, which is an injustice, or putting up in front of them a role model that's not really natural. That's all bred by so much people, so much propaganda. So as a culture, as a society, get to take a look at, is this right? Is this proper that we're doing to the young kids? So that's what I strongly feel about it. So when I wrote my obesity book, it is about this body image. It is about the taste factor, and it's about really fad diets and fad beliefs and all that, you know. But if you understand what you are inside is what matters, and then you can have a different kind of bodies. And also, just because you are a little bit overweight or obese doesn't mean that you are an unhealthy person. What matters really is how you feel, your energy wise, and also how is your chemistry, how is your inner evaluation of a medical evaluation shows you whether you're healthy or not. Okay, so that's something I'm going to discuss. Like I said, I wrote down so many areas you can question our wellness and see where we are and how we can. So that's why I'm going to make that list available to the attendees on Saturday, and if they want, they can choose any of those areas of questions. It's not simple questions, areas of questions. You know, and people can look at body weight, for example. They can ask. Questions about that. They can ask me about sleep apnea, any number of things we can discuss, and we can not only get the right medical help, but also get to the point where you can fix it and go forward in your life. And also, you can be more educated, more informed. That's why you are empowered with the condition of your own health in a better way. That's what I want to get. I want to lead these wellness pursuers to be empowered with the information and research findings or ancient wisdom, all those things, how best it could be, how well it could be. You know, once you have the understanding of where you could be with few interventions, I think even then people are going to fail a lot. But then we keep on trying and educating them, inspiring them. You know, a lot of patients are really happy that I sit down and talk to them. Actually, what happens is a new patient comes. That's when I spend the most time. Not only before he comes to the clinic, we get the records if are available, and then we review them, and then we form a formulation of what he's coming forward and all that. When he comes, I'll have much more discussion for a new patient. And after all that done, next time I come, I already know him, so I don't have to spend on my part so much time. But if he needs time to explain to me, I will be there. So even though I spend only 10 minutes, I don't know, it's the manner, it is the way I kind of allow them to talk, whatever it is, they feel like I spent enough time for them. They don't complain after that. So it is the initial time very important, also very critical times. Like something really bad happened, that also we give all the time, right? So there is a method to give enough time for the patient, but at the same time, not overwhelmed by that. Okay. Uh, Anybody else has any? Well, I have only a couple of minutes to go. After 5 o'clock, I have something I will be doing. Thank you all for coming, and thank you, Rufi and Elizabeth, for coming up. Uh, like I said, Rufi can communicate with me. Send me a DM, Rufi, if you will, if you want to. Then we can make yeah, time for you to come into my Facebook group or LinkedIn Live, whatever. So many ways I meet individual people, and then I can talk to them on the phone also, and we'll see where you can start take all those things and go from there. Okay. Thanks for coming up, and thanks, Elizabeth. She is a trooper, really, for us. Okay. Thank you. I will see you again later. But for now, thank you very much. Bye bye.